come through. Thank you. Round to the right hand side, sir. Excellent.
England is nearly there. In 3 weeks, the last restrictions are set to be lifted. But the British government says a slow rise in COVID-19 cases again threatens that goal. It's partly down to the B1617.2 or India variant, which is believed to be more transmissible, although not necessarily more deadly.
The latest estimates are that more than half and potentially as many as 3/4 of all new cases are now of this variant.
The new dominance of the variant, coming just after indoor dining and drinking resumed, makes it difficult to know what is driving the rise.
But I want to stress that we always did expect to see an increase in cases. That was always going to happen.
Variant cases are clustered in a few cities, and the highest COVID infection rates are among unvaccinated young people.
Last week there was a week when 1% of Bolton's 10 to 14-year-olds tested positive. I mean, that's incredibly high. We know from Public Health England that attack rate, so the chance of you being affected if you're a contact from someone with the Indian variant, is over 50% higher than if it was a contact with the old Kent variant.
Research suggests a second vaccine dose is crucial against this variant. According to official figures, it currently makes up just a tiny fraction of cases in Canada.
I wouldn't be surprised in the months to come that we definitely start to see a rise in the B1617.2 variant.
If that happens, provinces will be racing to get not just one but 2 doses into Canadian arms. But only focusing on Canadians will be short-sighted, according to global public health expert Ananya Banerjee.
We are on the verge of a vaccine apartheid, and that we need to make sure at least 10% of each country globally are vaccinated, particularly seniors and healthcare workers.
She says unless richer nations ensure that happens, other variants will appear, one of which might even evade vaccines and put us all back to square one. Redmond Shannon, Global News, London.